Thank you. Thank you for having me. It's a pretty cool event. We've been hearing over the last day and a bit about some pretty exciting things that are happening, how AI and other technology is being used in pretty exciting ways in the healthcare sector. Today I wanted to talk to you about e-commerce and how getting your communications approach correctly and getting it right can be used as the bedrock to use as a springboard to using some of these technologies, and how the communication between hospitals, suppliers and everything else within the patient pathway can really make the difference when it comes to technology. So who are we? We're Pagero. We're a global e-commerce platform that enables better communication between suppliers and buyers globally. Up until recently, I've been working with suppliers, hospitals, and trade associations globally, but specifically across Europe, to help them understand how they can embrace technology and look at a standards-based approach to the adoption of technology to help open up the supply chain and to help improve clinical productivity, operational efficiency, and patient safety, and how enabling the technology that's being used by suppliers, by hospitals, and all of the organizations in between can really make a difference. At Pagero, we have the same mission. Our mission is to deliver a world-class, open and smart e-business network to enable suppliers and buyers to connect. So that's to enable healthcare hospitals, healthcare suppliers and distributors to connect anywhere in the world for seamless communication between them and all of their trading partners. That leads to huge benefits, so open, interoperable standards. That leads to cheaper, faster trading relationships. And what we're actually seeing at Pagero is by plugging into a business network, by digitizing the flow of the communication between suppliers and healthcare organizations like hospitals, they're beginning to act differently. They're beginning to really make the most of the data that becomes available and changing the way they interact with their hospitals and customers. So what we're talking about is the trading of e-business documents, invoices, orders, price information, product information. So you're looking at me today and saying, but we already do that. There's a thing called EDI. Well, you might be. But there's a new approach and an exciting approach that really makes a difference by really using the single connection approach. But everyone's busy. Hospitals are busy, suppliers are busy. Suppliers, manufacturers are busy doing their day job. They're trying to increase their share of wallet. They're trying to deliver world-leading products and services to patients, to hospitals across the world and in local markets. And really, what does EDI have to do with patient safety? Well, nothing and everything is the answer, and I'll go on to explain how it's being used to drive some real innovation and some really positive benefits in the UK and in other markets, and how the NHS is adopting e-commerce and delivering some real positive change. But the busyness is an interesting point because suppliers, do they have time to re-look at the way they're communicating with their hospitals? Well, hospitals are busy doing their day job. They are trying to deliver improved patient safety. They're trying to reduce the burden of administration within the healthcare environment to release time back to care. And essentially, they're getting less resources. So my experience in the NHS is that they're having to do a lot more. They're having to deliver more patient safety, having to deal with more patients, an aging population, as we've heard already today, with fewer resources, with investment and funds that are being delivered at a less than optimal rate. So everyone's busy doing their day job. How does that work? Because if you look in the healthcare setting, the previous talk is quite relevant here because all of these busy things, less money, requiring to do more work and deliver more with existing or fewer resources, means that the trajectory is obvious. We're having to deliver more with less, but actually the resources are becoming scarce as well. So this is BBC statistic that by in 50 years' time we're going to have a huge deficit in not just the resources available, but the people. we're going to have fewer healthcare professionals available and trained globally, which is a problem. So let me tell you, I think it's obvious, technology and innovation is the answer, and this is going to help and support and is already helping and supporting healthcare supply chains, helping manufacturers and caregivers across the world already today. And this is something that is not going to replace people. It's not going to replace processes. What e-commerce is delivering within healthcare is interoperability, and it's the support. It's reducing the administration burden, and it's enabling time back to care. It's enabling hospitals and caregivers to get on with what they do best, their day job, and it's enabling manufacturers to get on with their job, delivering better products and harnessing better ways of doing more with less, rather than worrying about communication and transactions and all that kind of stuff. So we deliver a e-business network, and we digitize the flow of information that's important between trading partners across the world. Now let's have a look at the journey on how we got there. Last year I gave you a wonderful story about the humble beginning of the barcode and how that enabled modern day traceability. And that was the beginning. We saw the track and traceability of being able to take stuff from the supply chain, from you as a manufacturer or distributor into a care environment, and then start to track that through a hospital, through a patient pathway, from an inventory shelf to a theatre setting, and start to scan that all the way through. If you're a supplier in the room, the typical supplier I speak to has a problem. They share the correct information with their trading partners, with their hospitals, and they get rubbish data back. My hospital customers order from the wrong catalogue, they're ordering from the wrong price, they're using wrong product codes. I spend a lot of time and resource having to correct it. You go and speak to the hospital and they are ordering from the right information, using the right product codes, the right prices at the right time, but get the wrong products back from the suppliers. So everybody is doing the right thing, but getting rubbish back from the other one. This is a true story, and it is true on both sides. Now, the reason for that is the average hospital in the NHS has 250 IT software systems, etc., etc. So how are they talking to each other? Well, what we're actually seeing is some customers and hospitals are working together with EDI. They've digitized their flow. Others are receiving spreadsheets, uploading them into systems, and then they move it to the patient care system where they download and then re-upload it into the system. But in that period of time, they've received a new set of attributes and product information. So it's playing catch up with the constant change of information, prices, and all that extra rich safety information in these products, which is proving really difficult for hospitals and suppliers to get to grips with. So technology helps, and what we're seeing is the introduction of track and traceability and getting to the patient pathway, but we're also seeing hospitals and customers connect through networks, digitizing the flow. So you've got good flow flowing from the supply chain into the hospital. It's becoming less of a black hole. I delivered those goods last Thursday. I need to recall 100 of them. I know you've got them. Where are they? I have no idea. Let's go and look on some shelves or in patient records, and that's the case today. So there's drivers for digitizing this flow, for standardizing it and structuring it in a way that can flow from the manufacturer. And the manufacturer, by the way, has the right information with all of the right product attributes, the safety, the serial numbers, the expiry dates. So why does it get lost when it goes into hospital, and why are there still manual processes today in 2019? So that's one driver. There are many other drivers for why EDI and digitizing the flow of this information is important. So let's have a look at a few of those, and then we'll move to some examples of how it's being used today, and not just the monetary and efficiency benefits, but how it's quite strongly linked to patient safety as well. So one driver is straight up efficiency. EDI has been around since the 70s, since the 80s. It's been more widely adopted the following 2 or 3 decades, and the efficiencies are obvious. If you connect to your customer digitally and you start receiving product files, price information, ordering from up-to-date live information, then you know it's 100% accurate. traditionally, let's just go back 5 or 10 years, it's expensive. You've got an IT department, they've got an IT department, and you build a connection. And once that connection's up, it's highly efficient. Hopefully they don't change their IT and you don't change yours, otherwise you've got another IT project. Times that by 3,000 suppliers, I think the average hospital has, maybe more. That's very timely, very time consuming, very cost ineffective, and guess what, it's quite technical. But the value is there, and this is why EDI has existed, and nobody that has ever adopted EDI has ever stopped doing it, right? But there's got to be a more efficient way of achieving it. So one driver is efficiency and the traceability that comes with sharing extra rich information. The other is not healthcare related, but it's highly relevant. In markets across Europe, we're seeing, across the world actually, but this is a European example, there's a big tax problem. Governments around the world are beginning to look at tax as a big problem because they want more. They want the tax that they're not collecting. Well, as you can see on the screen, Italy is the biggest culprit. I think they equate to about 35% of the entire uncollected tax tickets across the whole of Europe. The only countries worse than Italy are in South America. And this is why digitizing invoice flows is becoming more prevalent. Okay, so nothing to do with healthcare at this particular moment, but what's being happened or happening across Europe is that you as organizations who serve anybody, specifically public sector, hospitals, local municipals, etc., are being demanded to start providing invoices digitally. Not by PDF, not on email, in this structured format. So then the tax authorities can get a better flow, better idea of what tax needs to be collected. And there's some side benefits to this, but that's happening in countries across Europe using slightly different standards and different ways of doing it. So if you're a cross-border organization, not just serving the Finnish market, but the rest of Nordics or the rest of Europe, you've got some standards to start adhering to. You need to start digitizing your flow. Other things, when it comes to reasons and drivers for change, is the obvious ones. You've got fake medicines coming around. So we've heard of FMD and the Falsified Medicines Directive, which is coming in. But fake medicines are a thing. There was a news article this week on the global BBC website to say that fake versions of Xanax are causing deaths in the United Kingdom and across Europe without even looking at the United States data, which is the most prevalent user of this particular drug. Now, this means that there is fake medicines in the supply chain not coming from a manufacturer. So how do you identify that flow? Other things within healthcare sectors and hospital environments happen whereby things are left inside people. We've got a website in the UK where they list never events, things that should never have happened but do happen, and that's replicated in every healthcare environment across the world. Things go wrong in healthcare. People are today going into theatre and receiving surgery in an area they didn't need to receive surgery on because the notes are incorrect. They're operating on the left side instead of the right side. And lastly, this is a popular example that I use quite a lot, but 10 years ago there was a French manufacturer of breast implants, and it turns out that they were using illegal, non-medical grade silicone inside breast implants. So this is a huge scandal. The company went bust, and still today in France, these executives are being sued right the way up to today. They're being identified. Now, hundreds of thousands of ladies across the world have potentially dangerous, highly prone to rupturing breast implants. So the idea is, let's fix the problem, let's get them out of them and replace them. Well, in the UK today, on our regulator website, there's still 35 to 40,000 women unidentified in the UK because they weren't accurately tracked and traced at point of care. They don't know where they were in. There are hundreds of thousands of paper records that they haven't been able to identify these. So they hope when they come reactively, they can check. But this is a problem. And this is the UK. So we were one of the least users of these because in the NHS they weren't prescribed. This is for the private sector. So product recalls, bit of a problem, fake drugs and things going wrong. That's my dinner from last night, but it's a good example. That's actually lasagna that a few years ago in the UK we had a similar example but in the retail side where Tesco, our largest supermarket chain, was found to be selling lasagna with horse meat in unexpectedly. Within 2 days, every product was taken off every shelf in every store, warehouse, and anywhere else in the supply chain. Anybody who brought those products with a loyalty card was identified and written to, and it was remedied very, very quickly. Now, if that can happen in retail through simple track and traceability, the idea is that it should be able to happen in healthcare. So we've got some drivers, and for those reasons, we're seeing a converging regulation. We're seeing FMD, Falsified Medicines Directive, which comes in this month. We're seeing same regulations in devices to say, well, actually, these things that we're making and putting into patients, shouldn't we be able to track and trace them more effectively? Non-medical reasons, for those tax reasons that we're seeing in Italy and other jurisdictions across Europe, we're seeing procurement directives and VAT directives, which are saying that, by the way, you, as anybody that serves public sector or organisations in European Union member states, must start digitising your flow of invoice information. So start digitising the communication between you and your trading partners. And you've got local requirements, which I'll touch on briefly in a moment. So what we're seeing here is a whole host of regulations and drivers for the need to digitise the way you communicate with hospitals and suppliers and distributors and anybody else involved in the supply chain. And the combination of that with using a modern approach. So it's expensive to start plugging in and digitizing that one-on-one, one trading partner at a time. It's okay if you've got one big customer, but if you've got many or you've got many suppliers, the way is to plug in to a smart, open, interoperable e-business network. Okay. Now the way that works is you plug in once, you do one EDI project to one network, one provider. It's then our job as that smart e-business network to go and find anyone else in the network. So whether they're using our network, Pagero online, whether they're using somebody else, we'll go and find them. You don't need to connect to them. You connect once. Globally, it's our job as your partner to go and find them. Hospital in Germany, a hospital in the NHS, a distributor in the Nordics, or locally in Finland. You've got one connection, and all of a sudden, you can go and connect to 100, 1,000 overnight, very, very quickly. And this modern approach, which we call EDI 2.0, is the future, because it's enabling you to start sharing that extra rich information. Because if you're making medical devices, if you're making pharmaceuticals or other products, legislation saying you have to have extra rich information, batch number, serial number, expiry date, coded onto the barcode, actually in the product information. So all of a sudden, by engaging with a modern e-business network, not a closed network, not just a few of your hospital customers in each market, but by using one globally, you can start to share this digitally. This information that's having to become available for other reasons, you can share it to the hospital. Well, guess what? By the hospital, instead of buying systems, but investing in proper open standards that their systems must adhere to, it means they can take that information into their supply chains, into their internal inventory systems seamlessly. So all of a sudden, you've got a direct flow from manufacturer all the way through distributors, freight forwarders, whatever else happens in the supply chain. You can then start to use that within the healthcare setting. And then you can take that and you can, with scanners and barcodes, which are on these products, you can scan that. You can scan that into and out of inventory. You've got automatic ordering using the right information, because guess what? You've got a digital flow. You can start to scan that all the way down to the patient. And that's what our customers are doing with us today. You can digitize an invoice, an order, a product catalog, but then when you marry that with a physical interaction within a healthcare setting, you can start to get real patient safety. So quickly, I'm just going to give you an example of what's happening today. So I work a lot with the NHS, and one example is the NHS takes or kind of handles around 20 million invoices annually, it's estimated. Now that's boiled down. There's not much national about the National Health Service in the UK apart from its title. There's 730 individual hospital or trust organisations that are autonomous and have their own boards, etc. So each hospital has around 5 to 10 staff handling these orders, handling these invoices. Like I say, they've got a lot of systems and they're under a lot of pressure to deliver savings. So in the NHS, they've got a local program. It's called Scan for Safety, and essentially they identified everything. Their patients through wristbands, as we see across Europe anyway, their locations, their rooms, and their staff members. Your job as suppliers into these organisations is to make sure the products are coming in are accurately identified, and it's digitally delivered through EDI, through open networks to the organisation, so it's not lost in translation, it's not downloaded, it's not transferred from one system to the other. That enables the triangulation that the right product was delivered to the right person by a qualified caregiver and in which environment they were given. That equals patient safety. And that's how this EDI stuff that isn't related to patient safety is really delivering change, because it allows the flow from point of inception all the way through to the patient record. And you can start to identify that that's a recalled product, that's an out-of-date product, that's not the prescribed product at point of care. That's decision-making, real-time support. And there's some huge benefits that are being made. There's a huge return on investment stat there. That was one particular trust, but the average from this program is a 4-to-1 return on investment. That's on inventory management alone. So there's huge cash releasing savings. But importantly, it's releasing time back to care. It's reducing the administrative burden and putting it back in. It enables NHS organisations, in this case, to take that information and really handle it accurately and effectively, knowing that it's accurate and correct. On the supplier side, they can start to make sure that hospitals are ordering accurately. They can take that data and they can enrich it in transit. Hospitals are using internal product codes, different product numbers, etc. They can start to enrich it on journey to make sure that it goes straight into their warehousing and order systems. That's what our customers are doing with us today. It's a trend I'm seeing across the world, and it's happening a lot in Europe. So my final advice here is, this is all for the patient, but you guys are already doing EDI and you're already sending and receiving orders. There's a better way to do it, or just to adjust the way you are doing it. So come and talk to us, and we can look at your local suppliers and providers and give you some really good advice. Thank you very much.